day, ma'am. Today, I am going to discuss about Module 4, Learners with Special Education Needs, or Lesson 2, Learners with Difficulties Seeing. It has 4 contents. The first was supported by Ms. Tagon, Maria Crucia, and now I'm going to report the second content, which is the identification. Identification of learners with difficulties seeing. Early identification is extremely important because early intervention will be most effective. Sometimes it is unclear whether a child has a vision problem or not. So the term early intervention has a literal meaning. It is intervening a child's development to provide support at an early time in his or her life. And also, early intervention is a system of services and supports designed to help families care for and encourage the development of their infants and toddlers birth to 36 months of age or 3 years old. Physical signs of vision problems include eyelids drooping over one or both eyes, or eyelids that do not completely cover the eyes when the child closes them. So, if your child's eyelids are drooping, it could be a sign of underlying medical condition, especially if the issues affects both eyelids. If a child has a clear skin, has jerky eye movements, or has eyes that do not move together, parents should see a pediatric ophthalmologist. These are other signs of visual impairment. First, not looking at the others in the eyes. Second, holding objects very close or very far to see them. Third, looking above, below, or off to one side of an object, rather than directly at it. Fourth, bumping into objects and having a lot of trouble seeing at night. Fifth, turning or tilting his head when he uses his eyes. After the identification of visually impaired, student under 3 parents should begin working with a childhood interventionist. So young children who are visually impaired are eligible for early intervention services, which can help a family through the child's first few years of life. And also, early intervention is vital in enhancing social, physical, and intellectual. When a child over 3, he will qualify for special education services if the visual impairments impact his education. Parents should contact their school district special education office to locate services for their child. A child with visual impairment may qualify for services from teachers of students with visual impairment, an orientation and a mobility specialist, a physical therapist, a speech therapist, or a psychologist, depending on individual needs.